Then, after years of pain,
no one could really diagnose her.
can the doctors solve this medical mystery?
I've ruled everything out. She probably had
Our next guest is a very special staff member who's been part of the doctor's family for many years. And when we heard she was having a mysterious health issue, we decided it was time to step in. Take a look.
So the first time Michelle came to see me, she came with a complaint of this chronic left lower quadrant pain that she was experiencing for almost 2 years.
I've had ovarian cysts in the past, and it felt kind of like that pain starting. It gets to the point where it's stabbing pain and it aches a lot.
Prior to seeing me, no one could really diagnose her. Right away, I knew that I had to find the source of her pain.
She did a full gynecological examination, but the primary thing that she did was the ultrasound to check the size of my ovaries to see if there was a cyst or if there wasn't.
So I go down the list and I rule out everything: endometriosis, adenomyosis, fibroids, chronic pelvic pain, pelvic congestion syndrome, hernia.
She went in, and I think for the first time in my life, she said that my ovaries look perfect. So I don't know where I got it from, honestly. I'm just praying my daughter doesn't get it.
The best next thing for Michelle will be surgery. I've checked every organ. When you rule everything else out, it is very likely that the cause of the pain are adhesions. But this level of pain affects their life, their work life, their family life, their sexual life. It affects them mentally, emotionally, and physically.
It would be awesome to not have to worry if I have pain relievers in my purse.
There's not a single human on this planet that could experience pain every single day and not get depressed eventually.
Hi there, Michelle. How are you?
I'm doing okay. I'm still experiencing pain. It started probably a little over a month ago now, and it kind of started as a dull ache, and then it became more of a sharp pain. And I have a history of ovarian cysts, so I had thought that it was a cyst. It was that feeling. I've actually had surgery to remove a twisted ovary with a cyst in it. So I'm kind of at this point where my doctor says to me, if you feel that pain and it's not going away, you need to come in and have it looked at. So I was a little concerned that that's what it was.
And you're a mom, so I'm sure you want to get to the bottom of it to determine if this is something that could be passed on to your daughter.
I am. My son very unluckily got my migraines, and my daughter has been able to steer clear of that. But I do have concerns that she might get this as well.
Well, we enlisted the help of our dear friend and colleague, board-certified OB-GYN here in Los Angeles, Dr. Aliabadi. Welcome back to the show.
Hi. Thank you for having me.
So when you first saw Michelle, what did you think was going on?
As soon as I saw her, after taking a good history, I did a complete physical exam. Her physical exam was normal. She did have tenderness and pain in her left lower quadrant. I did send her for an ultrasound of her left inguinal area to rule out a hernia because, like I said, she had tenderness in that area, and that's one of the things you have to rule out. Once I ruled that out, and she was still complaining of pain, I did a pelvic MRI. So in Michelle's case, I've ruled everything out, and the only thing left right now that I suspect, and I had suspected from the beginning, was that she probably had adhesions from her prior surgery. She had surgery on her left ovary, and that's exactly where her pain and tenderness is. A lot of patients after surgery, especially abdominal or pelvic surgery, develop adhesions, and these adhesions can start a few days after surgery and they can progress. And eventually they can pull and cause pain. They can pull and put pressure on different organs. Because we've ruled out everything else in her case, the only thing left is to do a quick outpatient laparoscopic surgery. We make tiny incisions and we put a camera to the belly button and we look, and I'll be able to see if she has any adhesions. And usually when we cut those adhesions, their pain is immediately resolved.
These type of post-surgical adhesions in and around the female reproductive tract is quite common, correct?
They're very common, and you have to remember endometriosis can cause adhesions without having a history of pelvic surgery. So that's why I think the most important message is to remember that any type of chronic pain is not normal. Painful periods are not normal, and any type of pain should be worked up.
So what's next for Michelle, Dr. Aliabadi?
So the next thing is to basically make sure we find a time that works for her. And like I said, the procedure is very quick. It's straightforward. It really doesn't have downtime because the incisions are very small. So if she can take 2-3 days off, I'll be able to look inside and hopefully fix her pain.
Michelle, how does that make you feel hearing you need surgery?
A little bit apprehensive, but it's also nice to know that there's light at the end of the tunnel and that potentially what I'm experiencing will go away and I can be normal.
That's the right thing to do, Michelle. You're in the best of hands. You know we love you. Thank you, Michelle and Dr. Aliabadi, for being here. It's a great, important topic for a lot of women out there.
Thank you for having me.
Thank you so much.
Thank you. We'll be right back.